The next exercise, we continue mobilizing the thoracic spine. However, this is in sitting. Functionally, this is what you can do in the office. After you sat for a while, you're probably going to stiffen up. And this is a suggestion of an exercise or a movement that you can do while at the office. You are going to rotate, block the movement, and exhale. Block the movement, so you push yourself away, and that will help you to rotate a little further. And exhale, push yourself away, rotate as far as you can. Once you've loosened up, we can add to this exercise. You maintain the position, hold it there, and we're going to do flexion and extension in this rotated movement or rotated position. There you go. Flex your thoracic spine, extend your thoracic spine. And then we can also do this to the other side. Include your breathing. So inhale, lift the ribs. Exhale, flex the ribs. Lift that sternum, stretch that fascia, stretch the soft tissue. Lift, increase the volume of your chest so you can get better lung expansion. Very good. While we're in this position, we can also focus on very specific rib movement and the connections of the ribs to the thoracic spine, how to move those joints. So one of the easiest ways to do that is you stabilize yourself, press down onto that hand or that arm, and literally reach up as far as you can. Something to look out for is not to lean over. This is the reason why you block yourself. You're literally just getting as tall as you can on the one side. Again, adding your breathing to it. Exhale, inhale. This is a really nice exercise or movement that you can do in your office chair. And then to the opposite side. Stabilize yourself, sit up nice and tall, expand as far as you can, reaching out, breathing. Inhale, exhale, squeeze that fluid, squeeze the air out of your lungs. Inhale, exhale. While we're in this position, we can also add another breathing exercise combined with thoracic and rib mobility. We're going to start inhaling and we're going to finish exhaling, and you repeat it using momentum to literally squeeze out that last little bit of air. The next exercise I want to show you will include thoracic, but especially rib mobility. Our model is changing the position so that you can clearly see from the side what needs to happen. You bring your hands forward, extend your hands, and you are going to round your spine, your ribs, and then lift them up, opening up that sternum. Again, you add breathing to this. You inhale, lifting your sternum, lifting your ribs in the front. Exhale. So your shoulders stays stable and your scapula move forward and backwards along with your rib attachments, and we call this protraction and retraction. And the last exercise I want to show you, we call diaphragmatic breathing. Something you can just really try and practice. Sometimes we start breathing with our shoulders. That's incorrect. We want to flare the bottom of the ribs because this is where we expand the lung volume. And in order to do that, you can do one of two things. You can either put your fist right under this little bone called the xiphisternum, and when you now breathe, focus on not expanding your upper chest and shoulders, but to use your own lung volume to lift your fist forward, pushing against your fist. If you have difficulty doing that, put your hands on the lower part of your ribs and try and expand your ribs into your hands while you maintain the upright posture and focus on not elevating the shoulders.